Hello, everybody. My name is Michaela, and we'll be going over the influenza virus today. So, starting off, the influenza virus is also known as the flu. It is a virus caused upper respiratory tract infection through the nose, throat, or lungs. Direct contact, respiratory droplets, and aerosol inhalation transmit this virus. It can cause a mild to severe illness and sometimes death in elderly people or toddlers. Influenza is usually only life threatening to babies, toddlers, and elderly people. The RNA genome of this virus exists as 7 or 8 segments, each coded with a ribonuclear protein and encoding 1 or 2 specific viral proteins. The influenza virus is surrounded by a lipid membrane envelope, and two of the main antigens of this influenza virus are the spike proteins hemagglutinin and neuraminidase. These spike proteins of H and N play important roles in the viral infectious cycle. And over here to the right, I do have a model of the RNA genome. And then moving on to the symptoms of influenza, the main ones are headaches, fevers, which typically run high, tiredness, aches, a runny or stuffy nose, sore throat, coughing, and vomiting. There can also be complications after having the flu, which can include ear infections, sinus infections, bacterial pneumonia, and worsening of the chronic medical conditions you may have. It is important to note that the flu and common cold have many of the same symptoms as well. Moving on to causative agents, influenza is caused by the virus with the same name. It is a single-stranded helical-shaped RNA virus belonging to the Orthomyridae family. Three main types of the influenza can infect humans and one that does not. The first one is influenza A. This is the most common and severe type, responsible for seasonal flu epidemics and pandemics. Influenza A viruses are divided into subtypes based on two surface proteins. The first one is hemagglutinin. HA helps the virus bind to the host cell. The second one is neuraminidase, which is NA, and it helps the virus release new viral particles from infected cells. Influenza A can infect humans as well as various animals, including birds and pigs, which can lead to the emergence of a new virus strand. And then the next one is influenza B. This type also causes seasonal epidemics but is generally less severe than influenza A. Influenza B viruses can only infect human and seals and does not have any subtypes like influenza A does. Influenza C, this type causes mild respiratory illness and is less common. It does not cause large scale epidemics and is less likely to lead to severe disease. Influenza C mainly infects humans and pigs. In addition, influenza D viruses, which primarily affect cattle, have been identified, but they do not typically infect humans. So most of the time we are only looking at the influenza A, B, and C because they are the only ones that infect humans. So they are the most important for the humans. Moving on to the antigenic variation, there are two different types. The first one is antigenic drift. So this one is a major genetic mutations in the HA and NA genes during the viral replication, which results in changes in the viral surface proteins. This gradual change leads to new viral strands that may not be recognized by the host immune system, contributing to annual flu epidemics. And then the next one is antigenic shift, which is a more dramatic genetic reassortment, occurs when two different influenza A viruses infect the same host cell, leading to a new viral strand with a completely different HA or NA. This can result in pandemics if the new strand is easily transmissible and virulent in humans. For example, the H1N1 pandemic of 2009 is an example of an antigenic shift. Moving on to the pathogenesis of the flu, the first thing is transmission, which is through the respiratory droplets or contaminated surfaces that we touch. The next is the entry into the host, which the influenza enters through the respiratory tract through the nose, throat, or lungs. Then the viral attachment, the hemagglutinin, binds to the salic acid receptors on the host cell surface. Then viral entry, the virus enter host cells via endocytosis. Then the replication, the virus hijacks host cell machinery to replicate its RNA and produce viral proteins. Then moving on to assembly and release, newly formed viral particles are assembled and released via neuraminidase. Host immune response. The immune system detects infection and responds with inflammation, which can consist of fever and fatigue. Activation of innate and adaptive T cells immune responses. Then complications in severe cases, viral damage may lead to pneumonia, ARDS, and secondary bacterial infections. Moving on to Reulin's factors. The first one is hemagglutinin. It facilitates viral entry by binding to host cell receptors. Next one is neuraminidase, promotes viral release by cleaving salic acid residues. Antigenic drift, minor mutations lead to seasonal flu outbreaks. Antigenic shift, major genetic changes lead to pandemics. Polymerase complex enhances viral replication. Immune invasion, inhibits host immune responses to facilitate viral replication. And cytokine storm, which is overreaction of the immune system, leading to tissue damage in severe cases. Next, moving to transmission. The first one is airborne. It spreads through respiratory droplets when an infected person coughs, sneezes, or talks. Then direct contact, spread via touching contaminated surfaces and then touching the mouth, nose, or eyes. Close contact, shaking hands or hugging an infected person can transmit the virus as well. And then the incubation period, symptoms appear 1 to 4 days after the exposure to the virus. Next, the epidemiology of the flu. First, the global effects. Influenza is a global disease that affects people all over the world. In the Northern Hemisphere, influenza typically peaks in the winter months, November through April. Currently in Virginia, we are in this peak right now. We are in our winter months. In the Southern Hemisphere, the flu season is generally between May to September. In tropical regions, the flu can circulate all year round. According to the CDC, around 3 to 5 million cases of severe influenza cases occur worldwide. In the US alone, the annual flu cases on average are between 9 million to 41 million, with between 140,000 and 710,000 hospitalizations and 12,000 to 52,000 deaths. The flu is the most common in North America, Europe, Asia, and parts of the Oceania, where it follows seasonal patterns. In countries like India, Brazil, and the Southeast Asia, the flu can occur year-round. When the influenza strains emerge through antigenic shift, they can lead to global epidemics affecting populations worldwide, as seen with the H1N1 pandemic in 2009 and the 1918 Spanish flu. The high-risk groups, they consist of the children, which are especially under 5. They are more likely to develop severe illness and complications like pneumonia or dehydration. Elderly people 65 and older are at higher risk of severe illness and death due to weakened immune systems and sometimes existing health conditions. Pregnant women, they are more vulnerable to complications including premature birth or respiratory distress. And people with underlying health conditions such as chronic respiratory diseases, heart disease, diabetes, weakened immune system, and obesity are also at high risk as well. Moving on to culture and diagnosis, there are laboratory tests that are done when you go into the doctor with flu-like symptoms. The first one that is most of the time done is the Rapid Influenza Diagnostic Test, which is also known as RIDT, which is a quick test that detects influenza antigens in respiratory samples, such as nasal swabs or throat swabs. You get these results in 15 to 30 minutes, but it is less sensitive than the other methods. Polymerase chain reaction, which is a PCR test, is the gold standard for diagnosing influenza. PCR amplifies the viral genetic material, allowing accurate detection of the virus type, A or B, and subtype. For example, H1N1 or H3N2. Results may take a few hours for this test. We also use immunofluorescence science, and enzyme immunoassays are also used in some settings tied to identify viral proteins. Once again, the most common are RIDT and PCR. And then the treatment for the influenza, there are 4 antiviral drugs that are available. So the first one is the most common, which is Tamiflu, and that is the trade name for ostelivir phosphate. This pill, it can This antiviral drug is given as a pill or a liquid suspension. The FDA approved for early treatment of flu in people 14 days or older. 14 days or older, the antiviral drug is given twice a day for 5 days. This is the most common medication given to patients within the flu. Zenmavir is a powdered medication that is inhaled and approved for early treatment of the flu in people 7 years or older. The trade name is Valenza. Zenmavir is administered using an inhaler device and is not recommended for people with breathing problems like asthma or COPD. This antiviral drug is given twice a day for 5 days. The third one is Prevemir, is given once a day intravenously by a healthcare provider and is approved for early treatment of the flu in people 6 months or older. The trade name for this one is Raptivab. And then the last one is Baxavir Marvoxy, is a pill. It's given as a single dose orally and is approved for treatment of the flu in children 5 years to younger than 12 years who do not have any chronic medical conditions for all people who are older than 12. This is not recommended for the treatment of flu in people who are pregnant, lactating, or outpatients with complicated or progressive illness because there's no information of the use of this drug in these patients. It's also not recommended for the treatment of flu in hospitalized patients due to the limited data that this medication was used on them. There's not enough data to justify using it on them because there could be complications. Next, moving on to prevention. The best way to prevent the flu is getting the vaccine every year. While flu vaccines can vary in effectiveness from season to season, a flu vaccine is the best way to help prevent seasonal flu and its potential serious complications such as secondary bacterial pneumonia, osseous bronchitis, and more. Everyone 6 months and older should receive a flu vaccine every year. Antiviral drugs are a second line of defense that can be used to treat the flu. And over here to the right, I did put a poster. It says, "Together we can beat the flu. 6 tips to stay healthy this flu season." The first one is get the flu vaccine. Avoid contact with sick people. Stay home if you're sick. Wash your hands or use hand sanitizer. Cover your sneeze or cough always. Avoid touching your eyes, nose, or mouth always, because you can always pick up some type of virus. I also recommend if you're going into the medical facility or anything like that to wear a mask because you never know what somebody has or what they're going in for. I work in dentistry, so we're always wearing a mask to protect ourselves and the patients. So I definitely recommend that as well, just to keep yourself safe. The last page is just my references that I use for my PowerPoint. I just want to thank you guys for your time and listening to my PowerPoint about influenza.